Is your cat about to have kittens? You're probably nervous, maybe even panicking a little. You've been watching her belly grow, feeling the little kicks, Googling everything you can find, and now it's almost time, and you have no idea what to do. Most people think they need to take control, prepare everything, intervene, help. But here's what nobody tells you. Your cat doesn't need you to deliver her kittens. She already knows exactly what to do. What she needs from you is something completely different, and most owners get it wrong because they confuse helping with hovering. By the time we get to number 7, you'll understand the one thing your cat needs from you during birth that has nothing to do with towels, boxes, or veterinary advice. It's the thing that determines whether she feels safe enough to bring her kittens into the world, and it's simpler than you think. Let's start with the mistake almost every owner makes. 1. She doesn't need your help. She needs your distance. The moment most owners realize their cat is in labor, they do the same thing. They hover, they sit next to her, they watch every contraction, they reach in to check on her, they call her name, they want to make sure everything is going okay. But here's the thing. For a cat, birth is the single most vulnerable moment of her entire life. She can't run, she can't fight, she can't escape. Her body is doing something that demands every ounce of energy she has, and every instinct she carries is screaming one thing: do this somewhere no one can see you. In the wild, mother cats give birth in hidden, enclosed spaces far from the colony, not because they want privacy in the human sense, because a birthing cat is a target. Predators are attracted to the sounds and smells of birth. A mother cat who delivers in the open is a mother cat who loses her kittens. Your cat carries that same programming. When you sit next to her and stare at her while she's in labor, you're not comforting her. You're adding a presence to the most vulnerable moment of her life. Your intentions are perfect. Your love is real. But what her body registers is, someone is watching me. While I can't defend myself, the best thing you can do in the first hours of labor is be nearby but not visible. Same room if possible. Close enough to hear her, far enough that she can't see you watching. That distance isn't neglect. It's the greatest gift you can give a cat who's about to become a mother. 2. She already chose the spot. Trust her. In the weeks before birth, did your cat start acting strange? Crawling into closets, nesting in laundry piles, disappearing behind furniture, scratching at blankets, and rearranging them into circles? Most owners watch this and think, I need to set up a proper birthing box. And you should. A clean box with soft towels in a quiet dark corner is a good idea. But here's what most people miss. Your cat might completely ignore it. She might walk past the carefully prepared box and give birth inside your wardrobe, behind the washing machine, under your bed, in the one spot you'd never choose. Don't move her. Don't redirect her. Don't pick her up and place her in the right spot. Dr. John Bradshaw, who has studied feline maternal behavior extensively at the University of Bristol, found that a mother cat's choice of birthing location is driven by a complex assessment of safety factors that humans often can't perceive: temperature, sound levels, air movement, proximity to escape routes, enclosure on multiple sides. She's processing variables you can't even detect. When she chose that spot behind the washing machine, she ran an analysis more sophisticated than anything you could consciously calculate. She factored in every threat, every exit, every sound pattern in your home, and she decided, this is where my kittens will be safest. Your job isn't to pick a better spot. Your job is to make the spot she picked as comfortable as possible. Slide some clean towels nearby. Make sure she has water within reach. Then step back. She didn't choose wrong. She chose with millions of years of instinct that you don't have access to. And hey, if this is changing how you think about your cat's labor, hit that like button and subscribe. That's how we help more cat parents understand what their cat actually needs during the moments that matter most. 3. The first kitten takes the longest. Don't panic. Here's where most owners lose their nerve. Labor has started. She's panting. She's restless. She's vocalizing. And then nothing seems to happen for what feels like forever. 20 minutes, 40 minutes, sometimes over an hour before the first kitten arrives. Most people panic at this point. They think something is wrong. They call the vet. They reach in to check. They start Googling cat labor complications at 3 a.m. with shaking hands. But here's what you need to know. The first kitten is almost always the slowest. The birth canal hasn't stretched yet. Her body is doing something it may have never done before. The contractions are building in intensity. And between contractions, she may rest, groom herself, walk around, eat, or even purr. That doesn't mean labor stopped. It means she's managing her energy, the way her body was designed to. Active labor for the first kitten can take anywhere from 30 minutes to over an hour. Subsequent kittens usually come faster, sometimes every 15 to 30 minutes, sometimes with longer gaps. A pause of up to 2 hours between kittens is normal. The signs that something is actually wrong are specific. If she's been having strong, visible contractions for more than an hour with no kitten appearing, if you see a kitten partially emerged and stuck for more than 10 minutes, if she's bleeding heavily, not spotting, but a steady flow of bright red blood, if she's completely lethargic and unresponsive, these are emergencies. These require a vet. Everything else is her body working exactly as it should. Your anxiety in that moment is real, but it's yours, not hers. And if you project it, pacing, hovering, making noise, she absorbs it. A stressed owner makes a stressed mother, and a stressed mother has a harder labor. 4. She will do things that look alarming. They're not. If you've never watched a cat give birth, some of what happens next will scare you. You need to be ready for that, so you don't intervene when intervention isn't needed. She will eat the placenta, every single one. This looks disturbing, but it's essential. In the wild, leaving afterbirth behind attracts predators. Her body is programmed to eliminate every trace of the birth. The placenta also contains nutrients and hormones, including oxytocin, that help her uterus contract and stimulate milk production. Don't take it away from her. Don't be disgusted. This is her body recovering in real time. She will chew through the umbilical cord. It looks rough. It looks like she might hurt the kitten. She won't. Her instinct tells her exactly where to bite and how hard. She's been carrying this knowledge in her DNA since before your species existed. She will lick each kitten aggressively, not gently, aggressively, hard, fast, repetitive strokes across the face and body. This isn't affection yet. This is emergency medicine. She's clearing fluid from their nose and mouth so they can breathe. She's stimulating their circulation. She's activating their lungs. That rough tongue is the difference between a kitten who breathes and one who doesn't. She might ignore a kitten for several minutes while delivering the next one. This looks like neglect. It's not. She's triaging. The kitten being born needs more immediate attention than the one already breathing. She'll come back. She always comes back. Every one of these behaviors looks wrong to human eyes. None of them are. Trust the process. She has done this before, even if she hasn't. The knowledge is in her body. 5. The first 24 hours decide everything. Here's where your role becomes critical, not during the birth, after. The first 24 hours after delivery are the most important period in the kitten's lives, and your cat knows this on a level so deep it changes her entire personality. The playful, independent, aloof cat you knew, she's gone. In her place is something older, something fiercer, something that will not leave those kittens for any reason. In the first day, the mother cat will barely eat. She'll barely drink. She won't use the litter box unless it's within steps of the nest. She won't sleep in any traditional sense. She'll lie curled around her kittens in a tight C shape, her body forming a wall between them and the world, and she'll growl at anything that comes too close, including you. Don't be hurt by this. Don't take the growl personally. She's not angry at you. She's running a security protocol that hasn't changed in 30 million years of feline evolution. For the first 24 hours, every living thing that isn't a kitten is a potential threat. You are not exempt. No one is. Your job in these hours is invisible support, fresh water placed near the nest and not handed to her, food placed within reach, not presented with eye contact, litter box moved close so she doesn't have to leave, lights kept dim, noise kept low, no visitors, no other pets in the room, no children reaching into the box to touch the kittens. You help by creating conditions, not by being present. 6. She counts them every time. Here's something most people never notice. Watch your cat in the hours after birth. Every time she shifts position, every time she stands to stretch or eat or drink, she does something before she lies back down. She counts, not with numbers, with her nose. She touches each kitten with her face. She sniffs each one. She nudges each body. And only when she's confirmed that every single kitten is accounted for does she settle back into position. If you remove a kitten, even briefly, even to check on it, she knows instantly. She'll She'll vocalize, she'll search, she'll become agitated in a way you haven't seen before, not because she counted wrong, because her system tracks each kitten as a physical extension of herself. A missing kitten isn't a lost object. It's a missing part of her body. My cat had 4 kittens. Every time she got up, she nosed each one. 1, 2, 3, 4. Then she'd curl back around them every single time for weeks. Even when the kittens were crawling, mobile, moving around the room, she'd do a head count before she could relax. 4. Okay, everything's here. I can breathe. This is why you should never handle kittens in the first week, unless medically necessary, not because she'll reject them. That myth is largely exaggerated, but because every time you take one, you trigger a response in her body that floods her system with cortisol. You take a kitten for 30 seconds. She spends 30 minutes recovering from the alarm. Let her count stay correct. Let her system stay calm. 7. She doesn't need you to save her kittens. She needs you to believe she can. Here's what everything has been building toward, and it's the one thing that separates the owners who help from the owners who hurt without meaning to. Your cat is about to do something extraordinary. She's going to bring life into the world using nothing but her own body and an instruction set written into her DNA millions of years before you were born. She's going to deliver each kitten, clear their airway, start their breathing, sever the cord, clean the evidence, and wrap her body around them before they've taken their 10th breath. She's going to do all of this without a textbook, without a hospital, without a single word of guidance from anyone, and she's going to do it perfectly, because this knowledge doesn't come from learning. It comes from being. Every mother cat before her did it, and every one of them passed the knowledge forward, not through teaching, through blood. The single biggest mistake owners make during cat birth isn't failing to prepare. It isn't choosing the wrong box or the wrong towels. It's not trusting her. It's hovering because you think she can't handle it. It's intervening because silence feels like something's wrong. It's reaching in because watching is too hard. Your cat doesn't need you to deliver her kittens. She doesn't need you to cut the cord or clean the mess or warm the bodies. She needs you to do the one thing that's hardest for someone who loves her. She needs you to step back, stay close, stay quiet, and trust that she was built for this moment in a way you will never fully understand. The greatest thing you can give a mother cat during birth isn't your hands. It's your faith, the quiet, steady belief that she knows what she's doing, even when it's dark, even when it's scary, even when every part of you wants to reach in and help. She doesn't need saving. She needs you to stand guard at the door of the room where she's bringing new life into the world and make sure nothing disturbs her while she does the most important thing she'll ever do. Your role was never to be the doctor. It was to be the wall between her and everything else, the one presence that stands outside the nest and tells the world, she's in there and nothing gets past me. That's not doing nothing. That's doing everything.